and welcome to the ASMR clinic. My name is Dr. Calliope. I'm going to be taking care of you today. Would you mind if I just got your name and date of birth? Very good. And is that your preferred name? And how do you like to be addressed? Very good. Excellent. So, what is the reason we are seeing you here at the ASMR clinic? Oh, I see. I'm sorry to hear that. So we have some tingle immunity. Okay. Well, we're going to add in some more questions then, I think, so we can ascertain the nature of your tingle immunity. Now, before that, I'd like to ask just a few standard questions. Firstly, are you in any current pain or have any current discomfort at all? Okay. And any changes to the medical history that we have on file? Okay. And what about your family history? Any changes there? Okay. Any allergies? Okay. And what about medications? Is anything on the list changing? Okay. Very good. So, let's switch gears. So I have a short little questionnaire for you, and I'm going to be asking you about the nature of your tingle immunity, okay? Just answer these as best as you can, and we'll see what we can do for you, okay? All right, so what kind of ASMR do you primarily watch? Okay, very good. Is there a particular artist that you tend to watch the most? Okay. And how often do you watch ASMR in general? Whether it's intentional or unintentional videos? Okay. And when did you first notice that the tingle immunity had started to set in? Okay. And was it a gradual loss in the intensity of your tingles, or was it all gone all at once? Okay, very good. And currently, do you have full immunity or just partial? Which means, do you experience the tingles at all, or just lessened, or perhaps not what you usually do? Okay. And as best as you can recall, have you had any other times in your life where you had previous partial or full immunity? Okay. And how was that treated at the time? Okay. And did that work well for you, do you think? Okay, well, I think I have enough information on the nature of your immunity. So I'm going to conduct a examination on essentially your entire body. We'll see if there's any physical cause for your loss in the tingling sensation, okay? All right, so from this point onwards, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Excellent. Thank you so much. So we're going to start by doing some vitals, and I think, there we are. Have my thermometer right here. I put it in the same place every time, and wouldn't you know that I always forget where it is every single time. So I'm going to turn this on, and I'll have you open your mouth for me. Okay, and lift your tongue to the roof of your mouth. I'm just going to put this at the base of your tongue, and if you could just lay your tongue on top of the thermometer, we'll give it just a few moments. Excellent. Let me just record this data down. Okay. And now I'd like to take your pulse and respiration rate. So I'm going to be feeling the radial pulse in one of your arms, whichever is your preference. Okay, we can do this arm. So I'm going to put my first two fingers here. I'm going to put them right below your thumb on the radial artery here. I'll be able to feel the strength and the quality as well as the amount of beats per minute, okay? And just as I'm doing that, I'm also going to be noting your respiration rate. So we're just going to put my fingers on your artery here, and we're just going to wait for a little bit. Okay, very good. Let's see. Okay, so that's well within normal limits. And now let's get your blood pressure. Do you have any preference as to which arm I use for that? Okay, I'll just go ahead and use this one here. So let me pop in my stethoscope, and that'll free my hands up. Okay. And now let me grab our sphygmomanometer. Okay. So on the sphygmomanometer, we have this little guide here, and we have our tubing. The tubing will go down your arm, along the artery here. Nice little guide. And this will go on your upper arm. Okay, so let me just situate this. Tubing tends to get a little tangled. There we go. Very good. So I'm going to hold the dial in one hand, and I'm going to put the diaphragm of the stethoscope on the crook of your elbow there. And I'm just going to be inflating the cuff, and it will get quite firm, okay? We'll check your blood pressure. I'll just sit here. Wait. Wait for the first beat. And then waiting for Okay. Let that drain for a moment, and then we'll do that again. And just up the air out of the cup a little bit. We'll wait for the first beat. Okay, and the first pause. Good, okay. There we go. And we'll put this away for just a moment. There we go. Okay. Millimeters of mercury. There we go. Excellent. So, we've finished with the vitals. Now let's go ahead and take a look at you. So let me do just a general inspection real quick. I'm going to sit back and I just want to take a look starting at the head here. Okay. Just noting the symmetry and alignment of your body, of your features. Noting if there's anything out of the ordinary right off the bat that I need to be aware of and take a little look at. Okay, very good. Let's go ahead and take a look at your head. So I'm going to get quite close here. And we're going to take a look at your scalp and your head. So I just like to do a little run through of the hair. Just doing a little scope of the hairline here. Okay. And just around the ear. Good, good, good. Okay. Good. I'm just going to feel the head, making sure there's lumps and bumps where there should be, and making sure there isn't anything where it should not be. Okay. Let's see. Okay. Wasn't sure if okay, let's take a little look at your face real quick. Just looking at the skin, looking at the pallor of the skin, the quality of it. Okay, good. Right. You had any problems with your skin lately? Just a bit of dryness. Yeah, the changing in the seasons. I know, I find that my skin starts doing all sorts of weird stuff when the seasons change. It's very sensitive. It's a very sensitive organ. Okay, so let me just take a little look at your eyes here, okay? They look bright and clear. See? Okay. Eyelashes look to have a good amount, good spacing. Eyebrows are intact. And I'm watching just as your pupils expand and dilate. Okay, just gonna look at your nose. Very glad that we have this lull right now between allergies and colds. That little sweet spot in the autumn. Okay, let me just look at the lips here. Okay. Very good. And if you could just open your mouth a little bit, I'm going to just check the corners. Okay. Yeah, it's about that time for chapstick and whatnot, yeah. That's one of my favorite parts of fall, actually. I miss being able to put on chapstick and like have the tingling feeling if you use the peppermint or I like the pomegranate as well. Okay, you can close your mouth. I'm just gonna take a quick little look at the ears. A quick little look. Okay. And over here. Just a quick little look here. Okay. Alright. Give me just a moment. Alright, let's go ahead and do a little bit of testing on the face. So firstly, we're going to do a sensation test. I'm just going to be touching on different parts of your face. We're testing the trigeminal nerve. And I just want you to tell me if you feel a touch, okay? Go ahead and close your eyes for me. That way I know you're not cheating. Okay? Just let me know when you feel me touch your face, okay? All right. Good. 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 Mm-hmm. Good. Okay. Good. Good. Mm-hmm. Good. Mm-hmm. Good. Okay. You can open your eyes. And now I'm just going to be feeling the TMJ joint and the masseter muscle right in here, as well as the temporalis muscle right in here. Okay? All right, so I'm just going to come in and I'm just going to palpate the joint as well as the muscle, feeling the bulk of it. If you had any problems with your TMJ joint, with any muscle soreness here. And if you wouldn't mind just opening your jaw for me. Good. And closing it. Opening. Closing. Okay. And can you clench your teeth for me? Unclench. Clench. And unclench. Good. Now I'm going to feel the temporalis here. Okay. And I'm just going to palpate this area just a bit. Okay. And if you could open your jaw, close, open, close, and clench your teeth, unclench, clench, and unclench. Okay, very good. Excellent. So we took a look at your eyes, at the anatomy of them. Now I'd like to take a little bit of a deeper look, okay? So I'm just going to be shining a light into your eyes. You can look wherever you want, doesn't really matter. Just keep your eyes open, okay? Mm-hmm. Good. The other side. Mm-hmm. Good. Very good. Okay. So now I'm going to have you do a little test called follow the light, right? So I'm going to sit back here and I'm going to be shining this light. And I want you to watch this light using only your eyes without moving your head, okay? All right, so just follow this light. Focus on the light. Follow it as best as you can. Just follow the light. Focus on its movements. Follow the light. Very good. Doing really well. Just keep following the light. Good. Let's go up, down, up, down. Okay. Diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Good. Now keep focusing on this light for me, okay? Using only your eyes without moving your head, right? We're just going to go in and out. In and out. In and out. Let me switch sides. Focus on the light using only your eyes without moving your head. We'll go in and out. In and out. In and out. Okay, I'm quite pleased with that, I think. All right, let's take a peek inside your ears, shall we? So, I'm just going to grab a new speculum. And let's just snap this on, okay? Just like that. And let's take a peek inside your ears, okay? All right, so just hold still for me. And I'm just going to take a look here inside of the ear. Okay, so looks pretty clear. The pallor of the skin is good. There's no redness. I'm not seeing any signs of swelling. And the tympanic membrane. Let's see. Okay, so the tympanic membrane looks like pearly gray color. There's no perforation, no bulging. signs of an impaction of cerumen or a buildup, so that's good. Okay. Let's take a look at your other ear. Okay. Excellent. It looks like you take very good care of your ears. So, not seeing any erythema, no signs of irritation or swelling, and your tympanic membrane looks really healthy. I can see the cone of light, and I can see the tip of the malleus just behind it. Good color, good consistency. All in all, I am quite pleased with how your ears look, I think. Looks like they get cleaned pretty often, Yeah, maybe a little bit. Okay, so let's do a little hearing test, shall we? So I'm going to whisper some words into your ear, and I just want you to repeat them for me, okay? All right, so baseball, clip, can, flower, shoelace. Okay, what were those words? All right. Paper, cardboard, bookshelf, candle, green. And what were those words? Wonderful. Okay. Right, and let's take a little look at your nose, your mouth, and your throat. So I'm going to get a new speculum so that we can take a look at your nose. Just snap that on. Okay, and if you could just tilt your head back for me. Okay, and I'm just going to get real close. I'm not going to go inside the nose, but I'm just going to get real close here and take a look inside the nose. Okay, so nasal passages look good. They look clear. And septum looks good. Okay, now I'm just going to take a little look. The other side here. Okay. Alright, pretty much same story here. It looks clear. Tissues look healthy. Alright, you can go ahead and put your head back. And let's take a look at your mouth and your throat. So I'm going to have you open your mouth, and I'm going to light a little light in there. I'm going to push your tongue down with this tongue depressor, okay? All right, if you could just open your mouth for me. Okay, just like that. And let's take a look. So, just want to have a little look at the teeth. Okay, as well as the tongue. I can get a little bit of a look at the tongue. Okay, and your throat. Okay, and would you mind saying ah for me? Good. Okay, uvula looks good. Right, and if you could lift your tongue to the roof of your mouth for me. Good, okay. And stick your tongue out. Good, okay. You can put that back. Good, and let's check on your lymph nodes real quick, okay? So I'm going to start with the occipital right at the hairline at the back of your head. Okay, so just going to be rolling my finger And then the post-auricular, right behind the ears. Pre-auricular, right in front of the ears. And I'll just come underneath the jaw. We have the submental and submandibular. Just have to do a little bit of rolling here. Okay. Here we have superficial cervical. We have the deep cervical chain. We have posterior cervical. And then we come down to supraclavicular. Right above the clavicle. Okay, very good. All right, so those all felt normal. Right, let's take a little listen to your heart and your lungs. So, bringing the stethoscope back out. And I'm going to start with listening to your heart, okay? So you can just breathe normally here. And I'm going to start by putting my stethoscope right here. Listen to okay, and the pulmonic valve. Tricuspid. And the mitral. Okay, let's take a listen to your lungs. So I'm just going to have you take a deep breath in and out when I put the stethoscope on your chest, okay? Take a deep breath in. And out. Good. Nice deep breath. Deep breath in. And out. 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 Okay. Very good. Very good. All right, so I think we are going to take a little look at your hands, your arms, your legs, and your feet, okay? Let me just put this down real quick. Right, so if you wouldn't mind showing me your hands, okay? Palms down. Right. You had any problems with the joints at all? Okay, I'm just feeling the joints here, doing a little palpation. Very good. Let me test the capillary refill. I'm just going to press down on your nails. And release. Press. Release. Press. Release. Press, release, press, release. Okay, so that all looks good. And if you wouldn't mind just showing me your elbows real quick. Okay, just looking for any signs of psoriasis or arthritis here. Okay, very good. And I'm just going to feel your arm a little bit here. Any problems with your elbows or your shoulders? Okay. Okay, very good. And if you could just flip your hands over real quick. Okay, temperature feels good. Skin looks good. Okay, let's take a look at your legs and your feet. So, any trouble with your hips, knees, ankles, anything like that? No? Okay. So, shins look good, and rest of the leg, no pallor issues. Not seeing anything out of the ordinary. Couple bruises, that's about it. Okay, just feeling around the knee here. Okay, let's take a look at the feet. So I'm not seeing any swelling in the ankles. And I just want to check the capillary refill on your toes. Make sure you have good circulation. Okay, that looks good. All right, so I think overall, you look to be a pretty healthy individual. So I'm not seeing any physical reason why you would be having the tingle immunity, which could be good, could be a little disappointing. So good because that means there's nothing wrong physically, disappointing because then we don't exactly know what's causing it. So as far as treatment goes, I'm going to give you a few different things, okay? So we can reduce the amount of ASMR that you consume, and that may help. But you may have to go to not listening to any ASMR for a little while, just so that we can get that sort of unexpected quality to it. Oftentimes, the ASMR feeling comes from both the anticipatory part of it, but also because it's unexpected. We don't know what we're going to see, what we're going to feel. So we're going to start with reducing the ASMR content. And we'll try that. We'll try that for a week. And if that doesn't work, then we'll go a week without, okay? What we could also do is we could switch the types of ASMR that you typically consume. For example, if you tend to like more medical role plays, you may want to switch to more personal attention. Or if you like triggers, you can switch to role plays, vice versa, role plays for triggers. I find that personally, I enjoy unintentional ASMR the most when my ASMR tingle immunity starts flaring up. You could also switch to lo-fi, which tends to also go along with unintentional ASMR, but sometimes that lower quality, for whatever reason, is a lot more conducive to ASMR when you're not quite feeling it. So you could also try switching up creators, finding someone new. Again, we want that unexpected, anticipatory quality to it, and that may help. Okay? Wish I had some better answers, but we have something to start with. Okay? We can regroup and review if this does not quite work. Okay? Any other questions for me? All right. Thank you so much for coming to the ASMR clinic, and I really hope we can get your tingle immunity fixed. Okay? I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Thank you.
subscribe.